In a world where quality healthcare is synonymous with social status and financial privilege, the importance of medication donation centers and volunteer pharmacies cannot be overstated. That's why we visited the CMC, Central de Medicamentos da Comunidade Judaica, a pharmacy entirely run by elderly volunteers that receives and distributes medication donations to those who cannot afford them. However, what we found there was an extremely outdated and error-prone operation. Entries and exits of medications are recorded on paper, which increases the risk of data loss, rework, and makes it very difficult to manage registrations and expiration dates. On top of that, the absence of digital records threatens the continuity of the Solidarity mission. That's why we decided to develop BAMI, Banco Analítico de Medicamentos Israelita. BAMI is designed specifically for the CMC to manage and track medication inventory. But before we get into the technical side, it's worth talking about what truly drives this project. In Jewish tradition, a mitzvah is a good deed, an act done not for recognition, but because it's simply the right thing to do. The CMC embodies the spirit every single day. Elderly volunteers show up, give their time, and make sure that people who can't afford medication still have access to it. That's a mitzvah in its purest form. And for us, building BAMI was our way of being part of that same chain of goodness, using the skills we have to make their work a little easier and their mission a lot stronger. We built BAMI around the processes the volunteers already carried out every day. We didn't reinvent their workflow, we simply automated it. By keeping things familiar, we reduced the risk of resistance and made adoption as smooth as possible, especially important for a public with limited familiarity with technology. Because at the end of the day, the best tool is one that gets out of the way and lets people focus on what actually matters, helping others. Now, let's imagine you're a volunteer at the CMC and you've just received a new batch of ibuprofen. To register it, you log into BAMI and go directly to the Add Medications page, where all the necessary fields are available. These fields are integrated with an Anvisa database, Brazil's National Health Regulation Agency, which automatically suggests active ingredients already registered with the agency. So when you start typing ibuprofen, the system immediately recognizes the corresponding entry. Beyond that, BAMI also uses its own previous records to suggest other attributes associated with that medication, like the pharmaceutical form or dosage patterns already in the database. This makes registration faster, more standardized, and less prone to human error. One of the most important fields is the number of boxes received. After entering the quantity, the system asks for just one piece of specific information, the expiration date. This allows volunteers to register large donation batches quickly, without needing to create individual entries for each unit, which is a huge time saver when dealing with high volumes. Once registered, the medication immediately appears on the system's home screen, confirming it's been stored in the database and is available in the inventory. And this is where one of BAMI's key design choices comes in. We organized the medication display into two levels. The first level shows general information, like the active ingredient. If the user wants more detail, they can expand it to see the second level, specific data like lot number, expiration date, and individual identification. This keeps the screen clean, avoids information overload, and makes navigation much easier. The system also automatically calculates total medication quantities. Now, say you check your task for the day and realize part of the same ibuprofen patch needs to be sent to a partner institute. To do that, you use the search feature, which lets you look up medication by active ingredient or expiration date through a simple drop-down filter. Once you find the right entry, you select it, click remove, and indicate the destination. The system automatically logs this as an outgoing transaction, keeping the history updated and ensuring full traceability of the medication flow. After that, you can explore other important features. The expired medications tab automatically organizes all items past their expiration date, making it easier to identify them and decide on their proper disposal. That's also a near expiry alert section, which works as a preventative warning system, notifying volunteers about medication expiring soon so the team can prioritize their distribution before the upcoming unsuitable. This helps reduce waste and significantly improves inventory management. Finally, thinking about how we can support the CMC beyond day-to-day operations, we added a diagnostic report feature. Here, users can request a report generated by an AI trained on the system's inventory data and transaction history. To generate it, you simply select a theme such as incoming donations, outgoing distributions, or general movements, and define the time period you want to analyze. The system then automatically compiles the relevant data and produces an analytical summary, highlighting patterns, donation volumes, and distribution flows. The report also includes charts and visual representations, making it easy to understand at a glance. This way, BAMI becomes more than just a registration tool. It becomes an effective management instrument capable of saving volunteers time and improving decision making, turning data into trust.